Massachusetts has been a national leader in health reform, so we have near universal health coverage. So how do you see the state moving forward with health reform? What do you see the next step as being, and what would you do to make sure that rising healthcare costs don't limit access to care, especially mental health care?
Single-payer health care. This is one of the things that I think actually is a difference, that not every candidate apparently here supports a full single-payer system. Single-payer would reduce costs. It would reduce costs for prescription drugs by allowing us to bargain for them in bulk. It would reduce costs by eliminating the health insurance industry and insuring everyone through the state government, but leaving us to privately choose our doctors. It would cover undocumented residents of the state, and it would give smaller costs for state government, municipal entities, and also for businesses that now have to pay healthcare costs for their employees, which is one of the biggest things that increases in the budget of a school system or a state entity every year. So that's absolutely something that's a system level reform that we can be pushing for. That's the kind of thing that I can form a coalition of legislators to pass in the next few years. We've been talking about it for a long time. It's time to say we want it, and we're going to do it in the next few years. Let's do it.
Thank you. Mr. Goldstein-Rose.
Yeah, I feel an incredible responsibility to our senior citizens, many of whom were the youth activists of 50 years ago. And so I feel like I'm being handed this torch, and I want to do right. And many of you still are the youth activists today. So there's some obvious things. We need to be protecting Social Security and the state supplement program for that. One of the big things is prescription drug costs. These are manipulated by drug companies, and they're completely out of hand. This is another case where single-payer system is a system-level reform that would take care in a very large part of our inability to have any effect on prescription drug costs.
Rose.
Yeah, I also support Ellen's initiatives, and they go beyond abortion rights. In addition, she has great initiatives for new mothers and all sorts of things that encompass various aspects of this. One of the things at the sort of root place that we need to talk about is sex ed. We need to have much more comprehensive sex ed curriculums in our school. Those need to include inclusivity of all genders and sexualities. They need to include better access to contraception, and we need to be changing the economic and educational systems so that fewer people are in a place where they have to be making tough decisions about reproductive rights. I also echo the thing about age of consent. I think we could actually lower it to 14. 14 is the age that we let people make their own mental health decisions in most states, and so that's scientifically sort of agreed to be the age when you're mature enough biologically to make these sort of important decisions. So if mental health decisions, then why not also reproductive decisions?
And before
one other piece is that we need better mental health care. And this ties in with many people who are chronically homeless are also struggling with mental health, possibly with addiction. And one of the things that I want to do is create a statewide commission on mental health care and how we can do it right across the state, across an entire lifetime. Sam Rosenberg created something like this to think about casinos and how we could sort of make them, if we're going to have them, get the best parts of them. And it was a very comprehensive thing, and that's the kind of thing we need to do with mental health too.
Goldstein-Rose.
Thanks. I think we need better education systems as a preventative measure. Not just education about drugs, that too, but just better education in general. People have more economic opportunities. They will not be as likely to become addicted. Treatment, not incarceration, obviously. Attorney General Maura Healey has shown great leadership on this. She was a big part of the prescription drug oversight and rules being passed. A huge, huge part of this is mental health treatment, though. We need to integrate mental health treatment into schools. We need to integrate it into treatment centers for drug addiction. And one of the local addiction places is a Recover Project in Greenfield is a model. We need more places like that, more centers for people who are addicted to be able to get help, to be able to recover fully, and mental health is a huge, huge part of that for people to fully recover from addiction, which we would need to see as the disease that it is.